Good evening, everyone. Evening is the time for peace, to gather up the shattered mind and have a tremendous time. A very good and pleasant evening to one and all assembled here. On behalf of College of Nursing AIIMS Rishikesh, it's our pleasure to welcome you all for this online course on nursing education, measurement and evaluation. We hope that you will have a great learning ahead. Now, I would like to welcome our respected Principal Madam, Professor Dr. Smriti Arora, to formally welcome the gathering. Over to Madam.
Thank you, Dr. Xavier Belsia. A very good evening to all of you. A very warm welcome to Dean Madam, Professor Jaya Chaturvedi. Madam has always rendered endless support in all the initiatives of College of Nursing. Thank you, ma'am, for gracing the event. I welcome Mr. Arun Siraj, ECO, New Delhi. Thank you, Mr. Arun, for accepting. We will do many more courses together in future. A hearty welcome to our distinguished expert of the day, Dr. Poonam Joshi, Principal, College of Nursing AIIMS Kalyani. Thank you, ma'am, for taking time out from your busy schedule. I welcome our delegates who have joined for the program today. I assure you that you're going to have a great session today. Please listen carefully to the session and clear all your doubts. A warm welcome to the team of College of Nursing AIIMS Rishikesh, Dr. Xavier Belsial, Ms. Rakhi Mishra, moderator of the day, Dr. Rakesh Sharma, and our MSc Nursing students. My dear friends, in teaching profession, measurement and evaluation is very important. It gives an insight into the deficiencies or lacunae so that we can give more emphasis on certain areas where competencies are lacking. We can differentiate between a high-performing and a low-performing student and thus modify our teachings accordingly. Hence, without taking further your time, I welcome you all and please have a great session today. Thank you.
Thank you, ma'am, for your honest welcome address. To be inspired is great, but to be an inspiration is an honor. I'm very glad to invite our chief guest, Professor Jaya Chaturvedi, Madam, our Dean Academics, HOD, Department of Obstetrics and Gynecology, AIIMS Rishikesh. Ma'am, we would like you to address the gathering. Thank you.
Good evening, everyone. Respected Principal Nursing, Smriti Arora ma'am, and other dignitaries present virtually. And I think some are present in the hall also, along with Madam. So good evening, everybody. As we all know, education is a continuous learning process. Continuous learning process gives us a lot of things to know, and that is called education. So the formative assessments, summative assessments, everything is a part of our education system. And as Dr. Smriti said, everybody is having little bit different need. But ultimately, they have to pass a course which we will give to them. Some are doing very good in that course, some are lagging behind. But ultimate goal is to take all of them towards the bank of the river. We should not leave them in between the river. So to take them towards other side, it is very important that their need, we should just extract out from them what are the lacunae, what they feel can improve their thinking, can improve their learning. And according to that, we can form our OSCEs and OSPEs so that they can do well. So with these words, I'm saying that you can continue with your today's program, and whatever maximum you can extract from this, from the deliveries of your stalwarts, do best. Thank you so much.
Thank you, ma'am, for motivating and encouraging us. Now, we would like to we have with us Mr. Arun Kumar Silvaraj, DGM, ECO India, He is here with us. Sir, we would like to hear from you.
Thank you, ma'am. Very good evening, all who has joined today. Very fortunate to be joining you all today. First of all, thank you so very much to Dr. Jaya Chaturvedi, madam, and as well as Dr. Smriti Arora, madam, for giving us this opportunity to support you in this program. We have a larger MOU with the AIIMS Rishikesh, and the journey started with AIIMS Rishikesh way back in 2019, where Echo India is a non-profit organization that decided to support the AIIMS Rishikesh in conducting training and capacity building, support with the training and capacity building initiatives for the Department of Community Medicine. And today we've been, supporting many other departments and also supporting in various other initiatives for webinars and as well as, other skill building, exercises. I had the fortune to meet with the principal, madam, and we had a lot of deliberation, very productive, fruitful deliberations about how we can, collaborate and also do the same, exercise in utilizing eco platform for, skill building and, training needs for the nursing community as well. So today we are here with a lot of people joined, and we hope this journey will start from here and will continue to grow strongly and support you guys in the future endeavors as well. I'll stop with the short message. Thank you so once again for using our platform. We'll continue to support with everything possible from our end. Thank you.
Thank you, sir, for your sharing your inspirational thoughts with us. And we have come to the end of our inaugural session. Now, I would like to call upon our moderator, Dr. Rakesh Sharma, Assistant Professor, College of Nursing, to take over today's session.
Thank you, ma'am. So today's first session will be delivered by our beloved principal, ma'am, from AIIMS Kalyani. I would like to share okay, Mr. Gurdeep, can you share the screen, madam's slide about Poonam ma'am's slide?
Hello, Dr. Rakesh. I would like to share from my end.
Yeah, I'm having, but I
would
am
like to
not allowed to
just keep
share.
it as-
Mr. Gurdeep, please allow Dr. Rakesh to share the screen.
Mr. Gurdeep,
You
can you allow me
share.
to share the
You
screen?
can share now, sir.
You are muted.
You can share now, sir.
Yeah. So about ma'am, madam is presently working as a professor cum principal in the College of Nursing AIIMS Kalyani, and madam has achieved and received various awards. She has received fellowship in the nursing research methodology and evidence-based medicine in 2019. And again, in 2018, she has received as a fellowship in emergency nursing. In 2012, she has received the Best AIIMS Research Award from AIIMS Delhi, as well as in 98, she has received Best Infection Control Nurse as well. In 90s, she has received Best AIIMS Nurse Award too. Madam has published more than 90 research papers, and she has 3 books published in the field of nursing education, textbook in the pediatric, and procedure manual as well. Madam's interest in, she has interest in neonatology and pediatrics and simulation. With this, I would like to invite ma'am to start her session. Please, ma'am.
Thank you, Dr. Rakesh Sharma. At the outset, I would like to thank Dr. Smriti Arora for giving me this opportunity today to deliberate on psychomotor skill assessment. And I hope we have all the students with us, and I'll be trying to deliberate as simple as possible. And this is something all the students have already experienced one or the other time in their life. So let us just see what OSCE is and how do we do the psychomotor skill assessment. Kindly permit me to share my screen. Is my screen visible?
Yes, ma'am.
Am I audible?
Yes.
Thank you, Dr. Smriti Arora, once again for this opportunity. Today, I'm going to deliberate on assessment of psychomotor skills. Since the time immemorial, we all know that we have been subjected to some or the other kind of assessment or evaluation. This is considered to be one of the prerequisites. Before completing any training program, any educational training program, we have to have the assessment. So assessment is going to help us to be declared whether we are competent in that skill or not. So in today's session, I'll be deliberating on what psychomotor skills are, and I'll be also sharing my experiences while I was in AIIMS Delhi, and then later on after joining here in AIIMS Kalyani. What are the problems we are facing when we have our nursing officers getting appointed in the upcoming institutions, and why assessing psychomotor skills is important. So these are a few things which I would like to discuss today. So this is my proposed outline. I'll be just briefly describing a little bit about the history of how the newer methods have got evolved recently, and then what type of learning we have, what are the different levels of learning, what was conventionally existing when it came to psychomotor skill assessment, and what are the new methods. I would like to draw a comparison between the two. And then I would be talking about the advantages of the newer methods like OSPE, OSCE. What are the limitations? And then towards end, we would like to draw a conclusion, and finally we'll be dispersing with the take-home message. Thomas Huxley is a very famous psychologist as well as an educationist who says that students work to pass, not to know. Ultimately, what happens, they do clear the course, but they don't know. This is the reality which all of us have to agree. As I was sharing in the beginning that we have NOs coming from diverse places, as you all know that there is a lot of diversity as far as nursing education is concerned. We have many private sectors coming up, giving education. They may not be able to give the required clinical experience. They may not be able to give the certification of competence to our upcoming generation. So this is the irony which we have to accept. And now today we are going to ponder upon the fact that how we can ensure that they are becoming competent and skillful before they join the nursing profession. Nursing is both an art and science. We call it as art because it is to be nurtured. And this art has to be nurtured over a period of time. It is not just an overnight phenomenon. Like today, a person get enrolled and tomorrow or day after, the person is declared as competent. We also know that there are some institutions where non-attending phenomena is existing, which is rather very harmful for our profession. So nursing is something which is to be nurtured over a period of time, and usually it takes 4 years for our graduate students, the BSc students, to get certified as competent. And at the same time, what knowledge we are giving to them, that is also scientifically proven. We are trying to rationalize our each and every concept. Whatever we are teaching them, we give them the rationale behind it. So therefore, we call nursing as both art and science. And having nursing education is very important, making them skilled helping them to gain the mastery of the skills is what required at the time when they are gaining entry as a full-fledged nursing professional. So all these skills during the 4 years of course are imparted to the students painstakingly. Earlier, we were just depending on strategies like making use of demonstrations, making them practice number of times, taking return demonstration. This was the way. Now we have simulation also coming into existence, where we are trying to provide a very safe environment, psychologically safe environment to our students, so that they become confident and competent in performing the procedure before they actually perform these procedures in the real setting. So objectively structured examination is becoming popular these days. For the past 2 decades, this has been there. And now you will find most of the institutions, the leading institutions, they are using as a method of evaluation along with other commonly used conventional methods. This is something about learning, which each one of us already know, that there are 3 domains in which the learning takes place. We have cognitive domain, affective domain, and the psychomotor domain. It starts from remembering. Let's talk about the cognitive domain, where the learning takes place. We start remembering, we understand, we apply, we analyze, evaluate, and then create. Synthesizing and making new applications is something desired when we call ourselves as competent, and when we say that we have attained this mastery of the skills, we are supposed to be helping in synthesizing and as well as analyzing and making patient care appropriately provided to our patients in a highly individualized manner. The other domain which we are going to talk today is the psychomotor domain, and little bit about affective. Affective cannot be assessed in a laboratory setting, in a controlled setting, but definitely some amount of higher level of cognitive learning and psychomotor learning is possible in the lab scenario. So we'll see how it is possible and how we are going to make best use of our facilities, of our infrastructure in making our students considered as competent. This is the Miller's pyramid we have. Miller is again a great psychologist and an educationist, which has given this pyramid. And this pyramid helps us, whether it is an educational institution or it is a hospital, there this framework gets fitted very well. So we start with the basic knowledge. We acquire the knowledge and then we try to understand it in a better manner. From their level, the competence starts. So knowing how the things are done, then performing the things, showing how the things are done, and then actually coming into action. So it is all about translating knowledge into action is what Miller's pyramid is talking about. So this is not just by observing, but you are making the student perform in front of you n number of times, maybe rapid cycles of deliberate learning you are giving, and before you are declaring, certifying him as competent. Now, what was the scenario existing in the past? This is a scenario which I have experienced. Maybe this may not be relevant in today's scenario. As a student, I picked up chit. I know when I was assessed in the practical examination, we were provided with a bowl containing chits, and the students were supposed to be picking up the chit to know which experiment or which procedure a person or the student has to do. Everyone was not lucky. The luckier one gets the easier task to perform. But people who are calling themselves to be not so lucky, they may get some kind of difficult procedure. So this was the scenario existing in the past, and the student had to perform that procedure, followed by viva related to the procedure, and having also some component of journal viva. So this is how the students were evaluated, were assessed, and then towards the end, they were provided the certification as passed or failed. So this was the problem we were facing. There was lack of standardization. There was difficulty level was not of the same level. Some students used to get the simpler procedure, some used to get difficult procedure. So considering these things, now the scenario has got changed and now we have newer methods available to us. So earlier, the existing system in the past, whatever system was existing, where the tools which were used, the assignments, the tasks which were given, they were very vague and they were not standardized. They were not uniformly given to all the students. They were varying in the difficulty level. So they were lacking reliability and validity. We'll be also learning about reliability and validity in the later part of our discussion. So the conventional practical examination had the following lacunae. There was inadequate sampling of the course content. It's very difficult if you are making a person perform just one procedure on the basis of which you are giving a certification, it is highly injustice to the student. So there was inadequate sampling of the course content. Everything could not be covered. Inadequate emphasis was given on the skills. Maybe just one skill. By performing one skill, you cannot certify a person as competent. And we had a lot of emphasis on recall, like recalling, not actually performing, but recalling. And the 4 pillars of the test, that is reliability, validity, practicability, and standardization. These are considered to be the 4 core pillars of a test. They were absent. There was inadequate emphasis on communication. Like every candidate, every student could not be assessed for the communication. There was little emphasis on the students' feedback. Students' feedback was never considered. And ultimately, it led to lack of positive impact on the students' learning. Students who were facing difficult situations, they were having a lot of anxiety. And this anxiety was further having adverse impact on the performance of the students. So these were the problems we were facing when we had the conventional practical examination. Now we move on to the present scenario. In the present scenario, the OSCE and the OSPE, they are becoming popular. They are considered to be the standard methods of assessing candidates. So when we have a professional course, we have some broad objectives. Let's talk about the nursing education. At the end of the completion of the course, or maybe at the end of their first year or second year, if you are going year-wise, they have to demonstrate the practical skills. They have to make correct observations. They have to analyze and interpret the data. If you are giving them some available ready-made data, they should be in a position to analyze it, interpret it, and make a differential diagnosis and decide the future course of action for the patient. Demonstrate the spirit of inquiry and explaining logically the unexpected observations. So this is what is expected of a nursing student at the end of the course. We have different levels of education going on. We are preparing starting from auxiliary nurse midwife to GNMs, BSc, MSc, and we have PhD program also running. So each program runs with different objectives. And when we say BSc program, we are aiming towards the nursing officers who are able to provide quality care. When we talk about MSCs and the the PhD scholars, that time we say that we are interested in making the leaders who are going to take the nursing profession in a forward direction. So we have to have all the time broad objectives of any course in mind when we are doing the assessment. And every student should know what is he or she expected to be achieving at the end of the course. So the criteria for a good assessment, whatever tool you are using, it has to be a valid tool. Valid means it measures what it intends to measure. Reliability refers to consistency, means this tool, particular tool or test which you have, or examination which you have, or the task which you have decided, it should be performed by all the students. So we expect all the students to perform this task. It should be highly objective. Without the bias, without the examiner's influence, the candidate should be objectively assessed. So remember, whenever we have a conventional exam, there comes the anxiety component. We have the examiner's effect. Like many times our result depends upon the whims and fancy of the examiner. But here, when we are using a good assessment tool, we are ensuring that we have a valid tool, we have a reliable tool, a tool which is highly objective, where there is no possibility of subjectivity, and it should be practical also. So these are the 4 important pillars to be considered for deciding a good assessment tool. Now let's talk about psychomotor skills. Psychomotor skills are mainly assessed using OSPE and OSCE. OSCE means it is objective, structured, physical examination. Sorry, not physical examination, practical examination. So objective, structured, practical examination, while OSCE is objective, structured, clinical examination. We have been using these terminologies interchangeably, so we need to know what is the difference between the two. So you can see the 2 methods are differing with respect to the domain which you are assessing, with respect to time, space, where the assessment is to be carried out, in terms of examiner, in terms of checklist, standardized patients, and observers. So OSPE is usually done in the controlled setting, in a lab setting. So you are going to assess higher levels of knowledge, maybe analysis, not the understanding, interpretation, application. So these are the higher levels of knowledge you are going to assess. Along with that, psychomotor skills are to assess. While in OSCE means you are doing something in the clinical scenario. It's very close to the real situation, not exactly the real situation, but it is very close to the clinical situation. So there our main focus is on the psychomotor skills. In OSPE, the duration of each station varies from 2 to 4 minutes. But in OSCE, the duration, because you are expecting a person to perform a procedure, all the procedures are there, the clinical skills you are focusing at, actual performance of the procedure on a standardized patient or on a simulated patient. So you may have to give more than 4 minutes time per station. OSPE can be arranged in a big hall. You create some privacy by having curtains, but it can be safely arranged in a big hall, while OSCE, we do it in isolated rooms. For OSPE, the examiners, they are non-specific, like they need not to be the experts. Definitely, they are to be the faculty, but you can prepare any faculty for assessing the student in OSPE. 2 to 3 personnel would suffice. If you do not have adequate manpower, you can go for 2 to 3 personnel per hall, provided that you have some workstations and some stations are there for writing. While in OSCE, you require expert at every station. So more manpower is needed, more experts are needed when you are arranging the OSCE. Checklist is needed at both the places. However, in OSPE, if the given task is like identify the instrument, or is like briefly describing the ABC of bleeding, likewise, so there immediately there is no examiner at the station to directly observe. Here the student is writing. So you do not require checklist available at the site, but definitely later on, when you are evaluating the station, the writing station, there you may require the checklist, but definitely in OSCE, you have to have checklist. Standardized patients are not needed in OSPE, while they are required in OSCE. Observers, again, plus minus, depending upon the number of personnel available you have, number of manpower you have, you may decide. You can have more writing stations as compared to procedure stations. If you have adequate manpower, you can go for even all. Normally, we create a balance. In OSPE, we have approximately half of the stations are procedure stations and half of the stations are just meant for writing. While in OSCE, you require every station has to have an observer. Now, little bit about the history of OSCE and OSPE, how it got originated. So by looking at this slide, you will realize that it is not very old. Maybe it is 40, 45 years old, not very old, though the nursing education and the medical education is much older than the OSPE. It was first time developed in the University of Dundee in Scotland in early 1975 by Harden et al. Later on, he came up in the year 1979 with some modifications. And then finally, it was presented in an international conference in the year 1985. And this conference was held in Ottawa. At the time of presentation itself, there were more than 50 countries which straight away accepted it. They liked the concept so much, they were in favor of it and they accepted it. And since then, it's been used globally. So this is the most popular method of assessing our candidates, our students in the practical examination. Now, organization of OSCE, it's mainly of two types. You have procedure stations, you have question stations. I said, depending upon the availability of manpower, your infrastructure, you can decide. Ideally speaking, they should be half and half. Maybe you can make every alternate station as procedure station. Now, this is the flow chart we have for running the OSCE or OSPE. So we start with the clear objectives. You have to have a blueprint in your hand, which is the first and the foremost requirement. Have a set of clear objectives. Like for first year students, what should be my objective? We are teaching cardiopulmonary resuscitation to our students right from their entry level till the exit. Every student is supposed to be, they're supposed to be brushing up their skills. But in first year, maybe we can focus only on one aspect, like giving effective chest compressions. We all know that COLS, chest compression only life support, is as effective as provided a proper, the coordinated cardiopulmonary resuscitation. So you have to decide, like for my first year student, if the student is able to give quality chest compressions, that is good enough. So you have to have objectives in your mind, maybe simple procedures like assessment of the vital signs or simple communication, like greeting a patient, or maybe later on in the fourth year or third year, how to break a bad news, something like that can be planned. So the complexity, deciding the complexity of the stations is in your hand, is in the hand of the examiner. And it's always a teamwork. We never work alone. As one individual, you can never run OSCE. You have to have a team who are collaborating, cooperating with each other and running the practical examination. You identify the practical steps, you select the task. Some tasks are very, very lengthy. You may have to break up those tasks into subtasks. Like in case of CPR, you can see, we can assess various aspects, starting from calling for help, checking the scene safety, checking the pulse. You can break up. So normally we expect if our first year student is able to ensure the scene safety, is able to call somebody for help and able to provide quality CPR, that's enough for the student. We should not go ahead. So you have to decide what level is to be appropriate, considered appropriate for the student. So you have to break up the task into subtasks. Then we give some scores. We have to decide a score. Even for each subtask, you can do further division. I have an example. So with that example, I'll be able to explain you how we have given the weighted. You set up the stations. Then you conduct after orienting the students and the examiners. It's always good to have a trial run. If you're doing it first time, it's good to have a trial run. Then discuss it with the students and the examiners. Students also should know what are the aspects in which they are going to be evaluated. That becomes part of their formative assessment. When we are preparing them throughout the year, that time we expose them to all these exercises. But students are briefed about OSCE and OSPE before each exam. like the common set of instructions are given to the students. Same way, examiners should also know, so that the bias can be avoided from the examiner side. Then towards the end, we make notes of the process and review. So OSPE is not just looking at the end product, whether the student has given the injection or not, but the entire process, how the things were collected, how the injections were diluted, how they were loaded, and how the patient was prepared. So likewise, you can simultaneously view many aspects. So we are making notes of the process, take a review and analyze the results, and you can use the same for the students' assessment. So this is in a nutshell about the flowchart of OSCE and OSPE. So we have to have certain set of instructions for our students. These are the common instructions. Before any exam, we tell them, you have to display your roll number. Don't reveal your identity. Don't use your nameplate. You are going to only write your enrollment number. The common instructions, journal instructions like cheating is strictly prohibited. No use of mobile phone, because mobile is something which can create music. So the use of mobile phone during the exam is totally prohibited. So these kind of instructions are reinforced. Bring your own pen. Then we give them an idea about the rotations, how they're going to rotate. And we have to make them understand that every station is an independent station. So they can start from any station. The only thing is they should be able to complete all the stations. They should be able to move to all the stations. The time at each station, it's pre-decided. We have to decide, like we have decided 3 minutes time. There are some procedures which could be of longer duration, maybe double of the 3 minutes, say 6 minutes. So in that case, you have to give a rest station before your procedure or the station where you are going to have a procedure of longer duration. So time instruction is given. Then we have a person on the floor managing the movement. Somebody is there to manage the time. At each station, what is expected of them? So we have to tell them that there are few procedure stations, some are question stations. So accordingly, they have to perform. The test runs with the clockwork efficiency. So for that reason, we require a person who can manage the time. One person on the floor to ensure the safe movement of the students. Even outside, to avoid the contamination of the students, what we do, we have a pre-OSCE room and a post-OSCE room. We don't allow students to go back. So if we are allowing them, if we are leaving them free, the possibility of contamination, the possibility of leaking the stations, the information about the stations is very high. So just to avoid that, we ensure that the students, they remain with us. Prior to test, they all are in the pre-OSCE station area. And after exam, we make the students sit till the entire exam is over. And the beauty of this OSCE and OSPE, you can see, suppose if you have 15 stations of 4 minutes duration each, you can effectively evaluate 15 students over a period of 1 hour. This is something great, which will not happen if you have a usual conventional method of assessment. So this is the moment you can see the student are moving from station 1 to station 2, station 3, 4, 5, likewise, and then they have a final exit. So in this particular picture in slide, you can see only 5 stations are arranged. So it's normally recommended that you can have 10 to 15 stations for making the effective use of OSPE and OSCE. Now coming to the advantages of OSCE, and the same advantages, they do apply to OSPE also. It's a very reliable and a valid method. You can administer same test to all the students, and all the students, they are going through the same difficulty. It's valid because you have prepared it well in advance. You have shared it with the expert. You have established the content validity, construct validity, predictive validity, all validities you have established before the administration. Planning is a little bit difficult. It's to be planned 4 to 6 weeks or maybe 8 weeks prior to your actual day of test, day of assessment. But once it is done, it is going to help you a lot. So you have to give whatever stations you have planned, you have to discuss with all the experts who are involved in the examination, share the checklist, make all the stations as well as the checklist, everything validated by the experts. You can check the achievements outlined in the objectives. So you can tailor your program according to the objectives of the course. Examination can be planned well in advance. You can decide the complexity, how simple this exam should be, or how difficult we can make it. So always add a component of novelty. The same thing should not be repeated. Otherwise, what will happen? Students over a period of time will know that these are the questions, these are the stations, and they will pass on this information. So always have a component of novelty in it. Try to put different type of questions. And over a period of time, over years, you will have a question bank in your hand. Content and complexity of the examination is under your control. Wide range of skills can be assessed. As I said, we have 15 stations over a period of 1 hour, which is amazing. In 1 hour, you are assessing 15 skills of a student, which was not possible in any ordinary conventional day. You have standardized tests because you have got them validated. And there is no component of bias. The examiner cannot give any inputs. Examiner has a checklist in his hand and is seeing whether the performance was there or not. If it was not there, then some remarks can be added to the checklist, and it's highly objective in nature. Coming to the further advantages, life becomes very easy after initial hard work. You will enjoy it. No doubt, there is a lot of hard work into it. No, it's not that easy. Viva or practical exam, if you're doing in the ward, giving a case to an individual, it's not time consuming. You just have to distribute the patients on the day of exam and then evaluate. But this task requires proper planning. And the advantage is further, you will have easy organization. You can successfully complete in a record time. Within 4 hours, you can assess 60 students, which is just not imagined. It cannot be imagined with the conventional method. Over years, you get a question bank in your hand. The checklist can be reused. So you have got the checklist standardized so they can be repeatedly used. Even you can use it for both formative and the summative assessment. And the large number of students can be examined in a short period. There are certain drawbacks which can always be taken care of. They require a lot of efforts, no doubt about it. Teamwork is needed. As I said, one person cannot plan for OSPE. You have to have your team to help you. Large number of examiners are needed. But again, there is a scope for modification. If you're planning for, say, 15 stations and you have only 6 examiners in hand, so remaining stations you can convert into question stations, and you require checklists. So your work starts 8 weeks prior to exam. It's a coordinated activity of the staff. Everybody has to cooperate, then only OSPE would be successful. And it is so satisfying towards the end of the day. You feel that you have done some substantial work. You have done your work in an unbiased manner, and you have done justice to all the students. Now we move on to, it is just the same. Only thing I have already told you about OSCE, and when we differentiated between OSPE and OSCE. OSCE is the testing of nurses' competence on international agenda is very high. Conducting a traditional examination in the clinical area includes the workup of 1 to 3 patients, followed by a discussion. This is the traditional method, which has been replaced now with OSCE. Each component of clinical competence is tested uniformly and objectively. The examination is organized in the several stations, and each station focuses on a particular skill, like history taking, performing examination, evaluating physical signs, making a differential diagnosis, interpreting test results, and how to manage the patient, etc. So this I have said, we are assessing more of psychomotor skills, less of knowledge. While in OSPE, we have more of knowledge to be assessed and some component of psychomotor skills. We use them for summative assessment as well as for formative assessment. Formative assessment, as you all know, it is an ongoing assessment. The only thing is student has to take it seriously, should not take it lightly. If it is taken lightly by the student or by the faculty, it may not serve its purpose. Selection tests to pick up highly skilled personnel can be used as a selection test, and it's an adjunct to other methods of assessment. I told you Viva is one, short case, long case, like in MSCs, we are doing that. Along with OSPE, we are giving them short cases at the bedside, long cases, because by the time they become postgraduate, we expect them to have a lot of confidence and they will be able to manage any kind of difficult situation in the clinical. So here one example we have. We can make them take the history. We can engage them in clinical examination, identification of problems, formulation of investigations, and interpretation of investigations. This can, to some extent, be done in the lab also using OSPE. Outlining management, demonstration of certain procedures, communication skills, and health education. So here we have an example where it's been shown how the competencies related to respiratory assessment can be done. So you can give different related tasks, like take a history from a patient with hemoptysis, doing a physical examination. So this patient, say probably the same patient who has a fibrocavitary lesion in the lung, maybe due to tuberculosis, we do not know. Like this kind of scenario can be given to the students, and they may be asked to examine and give their findings. Related investigations, they can be asked to make an interpretation of it. Questions related to the findings can be directly asked by the experts. And then the patient management, what advice you are going to give to the patient. So now here we have some questions. So after having known about OSCE, here we have a few questions for ourselves. Will you call this assessment tool as a valid tool? Yes, it is a valid tool because it measures what it is meant to measure. Is it a reliable tool? Of course, it is a reliable tool. But remember, valid tool is going to be a reliable all the time, but there is no guarantee that a reliable tool is going to be a valid tool as well. So when we are confirming, make sure that it is reliable as well as valid. It should hit the bullseye. At the same time, it should repeatedly hit. Means you should be able to do same kind of thing repeatedly. So consistency is there. So objectivity is also there. OSCE or OSPE, it's a good assessment tool because it is able to maintain the objectivity. You have a checklist in front of you. With that, you are going to maintain the objectivity. So the scope of subjectivity gets removed from the picture. So both of them are, both OSCE and OSPE, they are good tools because they are practical. They can be used in any of the settings, and you can assess large number of students. So it is feasible, it is possible. There is minimum chance of variability. It is something doable and achievable. So here we are giving a lot of emphasis to the performance of skill. So we are right now talking about clinical examination. Students are observed while undertaking the task. Individual competence can be assessed. You have a control over a large content. You have given them multiple tasks to be performed in a short duration of time. And you are also controlling the patient and the examiner variables. The feedback is possible if it is an ongoing assessment. And the teaching learning errors can be corrected effectively. So it's one of the ways of learning for the faculty also who are involved first time in OSCE. There are certain demerits some limitations of OSCE, lacking holistic approach. Normally, we believe that at master's level, at PhD level, or at MS, MD level, we have to have a holistic approach, seeing the patient as a whole, not just focusing on one task. So this is one thing, and we have to accept it. This can be balanced. So towards the end, we'll learn how to make a balanced practical examination. It's demanding on examiner because examiner has to be expert, has to be there all the time, has to be a good observer. When you have patients in the clinical scenario, when you are doing in a control setting, calling by the patients or by making the standardized patients, it's very essential for to have a cooperative patients. Non-cooperative patients can spoil everything. So these patients, they are informed well in advance. We select those who are relatively stable, who are cooperative, and who are willing to participate in this program. We have to tell them well in advance that this assessment may take 3 to 4 hours, so you have to cooperate with us. And some amount of incentive should be given to those patients who are willing to be part of our OSCE. It requires a great deal of organization. If you compare OSPE, OSPE is much easier as compared to OSCE. So you have to identify the patients beforehand, decide, prepare questions, prepare checklists. So again, same thing, you have advanced planning, organization a day before, on the day of examination and after examination. So this is a cyclic approach being used. Every student is made to go to each station. Each station is followed by questions. So there is a related question to the preceding station. Now coming to so I'll take just few more minutes to complete how to do the checklist preparation. For OSCE and OSPE, for effective OSCE and OSPE, you have to have checklists. Checklists are most commonly used for performance evaluation. We have to list down the activities. The checklist is going to help the observer to note whether the act was performed or not. Observer records and he gives a score. It's a simple instrument consisting of prepared list of expected items of performance or attributes, which are checked by an evaluator for its presence or absence. Constructing a checklist, again, it's not an easy task. It's requiring a lot of time. Each statement is to be clearly stated in simple language. The type of checklist to be used in particular assessment, you need to decide. The list of items, how lengthy you want your checklist to be, what is your objective, what you are planning to assess, which component of the procedure is important for you, you can decide, and accordingly, you can prepare your checklist. While constructing checklist, avoid negative statements because it's very confusing. At times, we tend to, the examiner may tend to get confused. So negative statements should be avoided. Avoid lifting the statement verbatim directly from the text. Ensure that each item has a clear response, yes or no. It should be measurable. Review the items independently, and checklists must have a quality of completeness and comprehensiveness. So for each specific skill, a checklist is prepared by breaking down the skills being tested. This is an example of checklist prepared for CPR. We were assessing for our first year students, we made an assessment using OSCE and OSPE. So here a scenario was given. They had a, say, 56-year-old male who just collapsed in front of the main gate of AIIMS Kalyani. So how would you like to provide CPR? So here you can see that we have given more importance to the hand position. So your weightage can vary. Ensuring scene safety, we have given a maximum score of 0.5, assessing responsiveness 0.5, checking for breathing 1, because this is an important step which will decide what to do, whether to start with chest compression, whether to give a recovery position, or whether not to perform anything. So likewise, you have to decide the weightage. Then similarly here you can see we have given due importance to all the components of quality CPR. And maximum scores become 10. You have an obtained score. If it happens to be a formative assessment, do discuss with the student where the problems were, what were the weak points, what needs to be improved, what were the strong points. So likewise, this kind of discussion can be very useful for the students. And towards end, patients' feedback can also be taken. There are certain limitations of the checklist. They don't indicate the quality. So it all depends how we are framing the checklist. Only limited component of overall clinical performance can be evaluated. We have to be very specific in our approach while framing the checklist. Checklists are not that easy to prepare. Don't think that we'll prepare it overnight. And it has limited use in qualitative observations. So it has its own limitations. You cannot, maybe not be able to do where you have a quality observations going on. The next scale is rating scale. Rating scales are less frequently used. They are only used where you have some attributes like you want to see the communication aspect. So there we are. Normally we have not used very frequently the rating scales. That's just to touch upon. Rating scales, you have a set of opinion which describes varying degree of dimensions of an attitude or a phenomenon being observed. Again, there is a scope for subjectivity, which we have to try to avoid. As an examiner, I have to be very specific. Like initially we can give them some number and then we can translate it to some descriptive phenomena. Likewise, good, very good. So before that, if we have some kind of quantification, that may really help. So like 3-point scale, 5-point scale, or 7-point scale. So these are the various scales on which, Likert scales on which we assess the student's performance. So it's only meant for affective domain. So these are the various scales we have: graphic rating scales, descriptive rating scales, numerical rating scales, and comparative rating scales. Here, you can see on a continuum, you are giving a score. Again, it lies in the eyes of beholder, the quality. So maybe my expectations is very high. I would like to give less score to the student. So this is not a very popular way of assessing the student's performance in any of the OSCE and OSCE station. Same way, we have descriptive rating scales: excellent, good, average. Again, you will find some component of objectivity is missing. There is likely to be subjectivity. If we quantify, and then for every range, if we give this description, that would be nice, like we do in case of research. Numerical rating scales. Maybe patients' feedback can be taken towards the end. And this can be incorporated in the final results which you are making. Comparative statement, rarely we use it. We don't draw a comparison in terms of attributes between the two trainees or between the two students. So this is in general about the advantages. You can score them. You can score the behavior of an individual. It has a wide range of application. But in my personal experience, I have not used ever rating scale. Rather, I have used more of checklist. So as a conclusion, I would like to say that OSPE and OSCE, they are very motivating, interesting, and aspiring, both for the candidates as well as for the faculty. It may be requiring a lot of efforts. Planning is needed. There is coordination required on the part of every team member. So keeping that in mind, always go for an examination which is a balanced one. A balanced examination is the one which has some component of OSCE, OSPE. You can have 1 or 2 short cases, maybe at PG level or higher level. At the level of fellowship, we can give them short cases, long cases, viva voce. These things can be incorporated. With this, I would like to stop here. So thank you for giving me this opportunity. Over to Dr. Rakesh Sharma.
Thank you so much, ma'am. It was a wonderful, in detail explanation about OSCE and OSPEs, ma'am. You have started with the domains, Miller's pyramid, then scenario, expectations from the students as well as from the teacher. What are the characteristics of a good OSCE and OSPE, and psychomotor skills, how we can assess, then types, advantages, disadvantages. And even you have also touched about the constructions of a tool, checklist, and varieties or types of checklist. So it was a wonderful session, ma'am. This session is open for question answers now. If anybody wants to ask any kind of question or query, please feel free. You can post your questions in the chat box also.
Dr. Rakesh, this was something not new for them. They have already been subjected
I think
to
there's no
OSCE.
question. I couldn't see any question in the meeting chat. I think, ma'am, you have explained in detail and very in a simple language that I hope everybody understood the session. And with this, I hand over to Dr. Belchiel, ma'am.
Thank you, ma'am, for the wonderful and informative session. It was really, I definitely agree that it must have been an eye-opener for many of the students, those who have attended the today's sessions. I've also noticed some of the students were taking notes. So Miller's pyramid, and there are many concepts which are very important for their studies and for even for the faculty also to apply in their teaching practice. Now we have come to the end of today's sessions. I request all the participants to fill the feedback form, which is the link is given in the chat box.
Thank you so much, ma'am, for the wonderful session.
Thank you. My pleasure.
At the outset, on behalf of College of Nursing, we would like to thank Dr. Poonam Joshi, Professor and Principal from College of Nursing AIIMS Kalyani, and Dr. Rakesh Sharma, Assistant Professor, College of Nursing AIIMS Rishikesh, for conducting this session. And thank you, sir. Thank you, ma'am. And we also would like to thank all the participants who have joined with us. And thank you. And we hope to see you tomorrow. And the entire week, we are going to have these sessions and have a wonderful learning.
It's a great initiative. Thanks again, Dr. Smriti. Hope we have more and more such type of sessions for our postgraduate students.
Ma'am, please unmute.
I'm not able to.
It's also unmuted.
Ma'am, increase your volume. It's unmuted, but I think you need to increase the volume.
Hello. Shall I say again?
Ma'am, you were saying something. आपका आवाज नहीं आ रहा था.
Am I audible? Hello.
Yes, ma'am. Now.
Yes.
I'm saying it's a great initiative for the students, and they will be benefited with all the experts. I can see in the program you have very carefully selected the speakers. All experts are there. Definitely, it is going to be a very beneficial program for all the students. Thank you.
Thank you.
Thank
Thank
you,
you so
ma'am.
much, ma'am. Participants, please fill the feedback form. The link will be open for next 10-15 minutes, and then we'll close the meeting.